And I am back because my 20 minutes were out, but I'm back again. So like I said, I was a little concerned because normally it lasts twice as long, so you might want to get over to a hearing specialist. Now I'm going to do another test. It's called the Weber test, and I do the same thing, and it tests hearing conduction, but I put it on the top of her head. So you're going to tell me when you start to hear it and when you stop to hear it, okay? She hears it now. Okay, she no longer hears it. So that's it for the hearing test. Now I'm going to grab my scope again. I'm going to look in her nose, and what I'm doing is I'm inspecting and palpating her external structures. I'm looking at her nose, I'm palpating here. Do you have any pain when I do this? No. Okay. The external structures look fine. I don't see any abnormalities. Everything's in proportion. There are no lesions, and now I'm going to test the patency of your nostrils. I'm just going to close one nostril like this, and you're going to sit like this. Okay? Okay. Okay, so no obstruction noted here, which is normal. Now I am going to take my speculum, and I'm going to look up the nose. You can just keep your head just normal for now. Okay, now I'm going to have you tilt your head back. Okay, and so upon inspection of her nose, the nasal mucosa is red, it's smooth, it's moist, there is no swelling, no bleeding present, there's no deviation of the septum, there is, the turbinates appear to be normal, which is a good thing, and I don't see any polyps. Also, when I looked, there's no deviated septum. The septum appears normal too, so that's a good thing. And now I'm going to take a peek at your mouth. I'm going to look at your lips right now. Your mouth appears in proportion to the rest of your face. When I look at her lips, I'm not concerned about any dehydration. Another way I can check for dehydration is to pinch her skin, and I'm checking her turgor. It's within normal limits. Her skin goes right back to normal. There's plenty of elasticity here. Also, another way to check for dehydration would be for me to check out her skin, and I don't see any flakiness or anything like this upon inspection. So that's that. Now I'm going to grab my gloves again, and I'm going to check the inside of her mouth. Also, your lips are a little pinker than the rest of your skin, which is normal and good. Now I'm just going to have a look at, I'm just going to pull down like this. I'm checking out her gums. Her gums are pink. They're within normal limits. I'm also going to look up here. I'm going to put my fingers inside your mouth. I'm just going to, do you have any pain when I do this? I don't feel any lesions. I'm going to grab my white again. I'll look in here while I'm doing this. I'm going to have you stick out your tongue. Okay, now look up here. I'm looking at her hard and soft palate, and I'm feeling around up here too. Feels normal. I'm also going to feel behind her teeth. Okay, I'm going to have you stick out your tongue one more time. I'm going to pull on it. Okay, and there are no lesions present. Her tongue is a pink color too. There's no white color, any sort of film on top of her tongue. Let's see here. Her teeth are white. I don't notice any cavities present. She does not have any halitosis. Her gums are pink with a dotted surface. Her gums aren't bleeding, which is good. And the dorsal side of her tongue sort of roughened, and it has some veins present, and the ventral side of her tongue is the dorsal side is roughened and the ventral side is glistening, and it has some veins present, which is normal. Now, I also checked out her uvula, which hangs midline. It's like a pendant type of I don't know, area. It just hangs. It's hanging midline, which is good. Her tonsils are one on each side. They aren't swollen or anything like that, so I'm not concerned about that. Her palate's normal too. So now I'm just gonna I'm gonna check your gag reflex. So I'll just have you stick out your tongue. Okay. Again, I'm looking at the uvula one more time here, and it looks good. And the tonsils. Okay. And her gag reflex works. It's within normal limits. Now, I am going to inspect your neck. And what I'm doing now is I'm feeling around for, in your neck, you have plenty of lymph nodes. And so, I'm just feeling those. I'm going to start up here. Is there any pain there?
No.
Okay. And there are 10 that I'm looking at. There are several on the neck. So I'm going to have you tilt your head to the right. And to the right. I'm just going to feel around here. Okay, I'll have you tilt your head this way. Okay, and now I'm going to have you, did you have any pain when I did that?
No.
I'm going to have you kind of hunch forward like this. And I'm just going to check your cervical nodes. I don't feel any swelling or is there any tenderness here? So that's good too. So everything's within normal limits there. Now while I have you doing that, I'm going to check your carotid artery. I'm doing one at a time so that I don't cut off blood flow to her brain. Okay. I'm also looking here if there's no bounding pulse, or her pulse isn't bounding, and I don't see any, movement looking at her carotids. Now I'm going to have you hold your breath for a second. I'm going to check your carotid arteries. I'm just going to listen. I'm listening with the bell of my stethoscope. Okay, you can breathe again. So that sounds within normal limits also. I don't hear anything abnormal there. There's no swelling or tenderness, like I said, in her lymph nodes, so that's good. Now I'm going to, and also, let me check here. I'm going to check your trachea. Her trachea is midline. That's a good thing also. Now I'm going to check your range of motion. I'm just going to have you touch your chin to your neck. And then I'm going to have you just move your head back and forth like this. Okay. Any pain there?
No.
Tenderness? Okay. So that's within normal limits also. I am going to test your muscle strength. I'm going to put my hands here and I want you to lift your shoulders. Try to push up against me. That's within normal limits also. I'm not concerned about any range of motion with her neck muscles or anything like that. There's no pain and her movements are smooth and controlled. Now I'm going to check her thoracic cage here. I'm just looking for any sort of like protrusion, any sort of like barrel-shaped chest, anything like that. I'm going to palpate around. Any pain there?
No.
Nothing there?
No.
Okay. Everything looks within normal limits here. I'm going to have you stand up. I'm just going to look at your spine. Okay. So the spine appears normal. Her is straight and the thorax is symmetric with downward sloping ribs. The scapula is symmetrical from what I see. And now I'm going to check. I'm going to have you sit like this. I'm going to have you take a deep, deep breath. Okay. And yes, this is symmetrical also. I'm just checking for symmetrical expansion, so that's normal. Now I'm gonna percuss the costovertebral angle. Any pain there?
No.
Okay, very good. So I'll have you take a seat again. I'm gonna listen to our breath sounds. I'm gonna listen to your lungs, and I'm gonna listen to your front side first. You're just gonna take a deep breath, but I want you to make sure you take a deep breath in through your mouth, okay? Okay, and now I'm gonna listen to her back. Okay, ready? Deep breath. 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 Okay, very good. I heard some slight wheezing on her right lung base. But other than that, her lung sounds were clear, but just in the right base of her lung. Now, let's see here. I am just going to check your heart now. So what I'll do is, I'm going to have you lie down. You can. So right now I'm just going to palpate her apex. Right, I'm looking for her apical pulse, so I'm just going to go over here. This will be about, I'm going to lift up a tiny bit here. And I'm listening for 30 seconds because it's equal. Her pulse is equal. It's 68, which is good. I'll listen to it for 30 seconds. I'm also looking right now for any heaves, which I don't see. I'm also going to feel around for any. And while she's lying down, I'm going to listen to her heart sounds. I'm also listening for S1 and S2. And I'm going to listen with the bell of the stethoscope as well as with the diaphragm of the stethoscope. So S1 and S2 are present. I don't hear any swooshing in between, which is a good thing. That would indicate a murmur, possibly. There are no gallops, anything like that. And I'm also going to listen with the patient sitting up, so I'll have you sit up. Listen to the apex again. The aortic, pulmonic, the Erb's point, and down here the apex, which is where the mitral valve can be best heard. Okay. So Your heart sounds are normal. No heaves noted. Apical pulse was 68. And no murmurs, like I said, S2 and S1 and S2 present. That's the lub and the dub. Normal rhythm. And no extra heart sounds noted, so that's good. Now I'm going to test the upper extremities. I'm just going to have you stand up. I'm going to check your range of motion. So if you could just do what I do. Let's see. You can stand right over here, if you don't mind. But just you can look at me. And I just want you to do your arms like this. Okay? And just arms like this. 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 Like back. And forward. Any pain when you do that? Okay, very good. Now I'm going to check her strength, strength in the hands. If you could just squeeze my hands. Very good. Now I'm going to have you pull against me. Pull. Very good. Okay. And I am also going to, let's see, check her shoulder strength again, which we checked earlier, but just to do it again. Try to push up. Okay, very good. So her range of motion's good. Her muscle strength is good. Everything's smooth. Whenever I try to test her muscle strength. So normal muscle strength in the hands, the shoulders, and in her arms. And her arms is how I checked it, by pulling. Now I'm going to palpate her axillary node. So I'll just have you hold up this arm. And I'm just palpating to see if I feel any enlarged lymph nodes, any hardened lymph nodes. Do you have any pain? Okay, very good. So that's normal. I'm doing the same thing on her right arm. Any issues here? No. And I don't feel anything of concern. Everything feels within normal limits here. Now I'm gonna check. I'm gonna have you lie down on your back again, but you can lie this way if you like. And I am going to, I'm just checking her abdomen. I'm gonna take a peek here. I'm gonna grab a flashlight. Do you have a flashlight? And see them what they feel.
They probably feel on that side.
So I'm checking her abdomen for any irregularities. I'm also looking at her skin color. There's no cyanosis. Her skin color is the same as the rest of her body, and this is a good place to look at skin color because it's an area where you don't get much sun, so that's a good thing. So her abdomen is symmetrical, and her umbilicus is normal. She does have a piercing. She has 2 piercings. She has one in the umbilicus and one in her right lower quadrant. I don't see any drainage or anything like that. There's no crustiness noted. Now I'm just going to palpate the abdomen. You just tell me if you have any pain when I do this. No pain? Okay. I don't feel any, she doesn't have any pain, no tenderness, anything like that. So that is good. I'm just going to check and make sure this is still recording. Okay. So there are no mouth masses. I'm looking for a pulsation. I don't even see a pulsation. All I see is the movement with her inspiration and expiration of her abdomen. So I am going to palpate her abdomen in all 4 quadrants. I'm looking for I'm listening for vowel sounds, so I'm going to start in her right lower quadrant. It's present. Okay, and her vowel sounds are present. They're hyperactive. I guess you're hungry. So, are you hungry?
Yeah.
Okay. So I'm not concerned about her hyperactive sounds. And it's been 20 minutes, so I'm pausing this one more time.